Well, hello, Facebook world, and happy Sunday. If you're new to my page, joining me as always, the most followed veterinarian in the world, Dr. Karen Becker.
Good morning. Hi, everyone. Nice to be here. Thanks.
Thanks for being here. Today we have a very, very important topic for you, and that is what you see above me here, pain meds. Perhaps the most prescribed pharmaceutical for pets and for people and so on and so forth. A new study that just came out has some alarming results for some, and we really want you to know about these studies. Now, before we get started and we talk about what's going on here, very important, if you're just kind of tuning in or you're looking at the thumbnail and you're going to leave a comment in the comment section, know that this Facebook Live is about giving your pets pain meds, not giving them. The reason why I brought Dr. Karen Becker is because she's so passionate about pain management, multi-layered therapies that we want to talk to you about today. So on today's agenda, check it out. The free preventative ebook that Dr. Karen Becker made for you, 21 pages. What are NSAIDs? The new study and the risk that we were talking about, and the 3 must-dos if your pet is on NSAIDs.
So this is a massive topic and too much to cover. In fact, if we covered everything I would want to cover, we'd be here 3 hours. So I did make an ebook for you all. You can download it at foreverdog.com. And the reason I put this together is because it's a ton of information. It can be a little overwhelming, but most importantly, I wanted to be able to give you a resource that you could share with your veterinarian, or you could have a discussion. It's a good place to start when having this discussion. I do want to reiterate exactly what Rodney said. This Facebook Live is about how to do effective pain management. It is non-negotiable. In fact, life is miserable if you have unaddressed pain. It's actually inhumane to not give pain meds, especially after a dental or a surgical procedure or even, an injury. It's actually the definition of torture to deny your animal pain meds. So our recommendation is what we call a multimodal pain management therapy. And by using a variety of different modalities, you can actually decrease the reliance of having to use some of these NSAIDs. But the first question, what is an NSAID?
Yeah, check it out. So all of these drugs that you see here for dogs, these NSAIDs, well, it's basically like a medical abbreviation, if you may. NSAIDs stand for non-steroidal anti-inflammatory drugs. You know when you get up in the middle of the night, you got raging headache or back pain and you're flying to the grocery store and you're buying some Advil or some aspirin? Those are human NSAIDs, and they come with caution.
So in veterinary medicine, NSAIDs are by prescription only, and for good reason. These medications do carry some potential side effects. In fact, when we posted the preview for this Facebook Live, half of the comments were, oh my gosh, I hope you're not going to suggest discontinuing pain meds, which of course we're not. The other half of the comments, which were devastating, was really, I wish I would have known this. I wish I heard about this. I didn't know that this was a problem. And so this is really a PSA for you to become better informed to make better decisions. It's really important. So the problem with NSAIDs is the fact that as non-steroidal anti-inflammatories, they can have some potential side effects. Now, true pain management is actually done by blocking pain pathways with a drug category called opioids. And opioids are fantastic for managing pain, but they don't address inflammation. And inflammation is a big reason why our pets have pain. This category of drugs is actually the best, the most efficient way and the safest way to manage inflammation. But they come with potential side effects. And the big question is, how long is too long in terms of having your pets on NSAIDs?
Well, that's such a great question. And the study that we alluded to, check it out right here, Facebookers. Prevalence of gastrointestinal lesions in dogs chronically treated with non-steroidal anti-inflammatory drugs. The 3 prestigious vet colleges that put this together. Now, this was kind of important. The object of this was to determine the prevalence of GI mucosal erosions in dogs receiving chronic treatment with NSAIDs. What do we mean by GI mucosal erosions? Well, basically like superficial ulcers or sores. Check it out. 83% of those dogs that were in this study, although it was a small study, 83% developed those sores.
So think of this as your pet's GI tract. And erosions, or think of it, these drugs cause like irritations. So in essence, an erosion is like sandpaper, and it causes a little bit of irritation. Sandpaper in the GI tract doesn't feel good, but erosions can lead to ulcers. And ulcers can lead to perforations. And perforations is where these drug categories can become risky in terms of life-threatening side effects. So it's those ongoing progressive states of erosions leading to ulcers, leading to perforations that we want you to be cognizant about. So What about less time?
Well, look, the other thing that was kind of alarming in this study, keep in mind that the dogs were owned by medical professionals, veterinarians, vet technicians, vet assistants. Some of the most astute people in the medical world were on board to be able to watch their dogs. And guess what? They couldn't see that the problems were developing. These dogs were asymptomatic. Now, is this the only study this has happened in? Absolutely not. Check it out right here. 28 days study, 70% of the dogs, which is a larger study, also developed erosions, but check it out on the bottom. There was no clinical signs, which is another problem that you can't see. But does it take a month? Not really. In this study, 7 days only on NSAIDs, 73% of those dogs had GI erosion. Again, no signs. This is a problem for pet parents because we typically wait till we see a problem, then we go to the vet, and it could be a big problem by then.
So veterinarians do regularly prescribe acid blockers as at the same time that we prescribe NSAIDs. And acid blockers, this category of PPIs or proton pump inhibitors like Prilosec plus NSAIDs is a common thing. But that combination, the Journal of Veterinary Internal Medicine says, can lead to a raging incidence of dysbiosis. In fact, that combination can raise havoc in the gut at a faster pace because of the dysbiotic index.
Now, it doesn't just take the acid blockers to cause the dysbiosis. Look, check it out here. This study called NSAID gut microbiota interactions, right on the very bottom, scientists found that these NSAIDs were causing gut dysbiosis, aka leaky gut, aka if your dog has it, this could lead to inflammation, it could lead to allergies, it can lead to behavior changes because of the gut-brain axis disruption.
Yeah, so in addition to GI consequences, which you all need to be aware of, kidney damage and kidney failure, liver damage and liver failure can be a problem the longer your pets are on these drugs. In fact, the Journal of the American Animal Hospital Association published an article saying that this category of drug, NSAIDs, is actually the biggest group of veterinary drugs that are reported for adverse events to the FDA. The FDA posted on their website, specifically related to kitties, that cats, 1 dose of meloxicam, a common anti-inflammatory, not an issue. But repeated doses of meloxicam or Metacam can cause acute kidney failure in cats. So these side effects are progressive the longer your animals are on these drugs. 1 day, 2 day, 3 days, the potential for side effects are very, very low. But beyond 3 days, things can start to happen. And as Rodney mentioned, they happen quietly enough that we don't know it's going on. So why would your vet prescribe these medications on an ongoing basis? Well, one of the big reasons is chronic pain that's musculoskeletal in origin. So chronic arthritis and things that cause the body to hurt where your animals need ongoing pain management. It's a big thing. If that's the case, where your veterinarian is recommending that you stay on NSAIDs long term, we recommend that you do 3 things. We recommend that you begin a joint support protocol, which actually helps slow down the pace of degeneration, as well as physical therapy. Beginning joint support slows down how quickly the musculoskeletal degeneration occurs, and that in turn keeps your animal feeling comfortable longer with a lower dose of NSAIDs. We also recommend that you concurrently begin natural anti-inflammatories because adding a proactive protocol decreases the amount of NSAIDs you have to be giving. And last but certainly not least is we recommend that you begin a protective protocol not only for the GI tract but also for your pet's kidney and liver. So by doing these 3 things, if your pet is going to be on NSAIDs long term, you're dramatically minimizing the likelihood of side effects from occurring. Again, all those protective protocols, information about PT, information about this blended multimodal protocol can be found on foreverdog.com.
Now, look, again, don't wait till your pet develops some sort of pain and just do pain blockers and think it's over. You got to focus on the problem. Think of it like a torn cruciate, like an ACL tear in humans. If you're just taking pain meds and you're not addressing the overlying problem, that cruciate will tear completely, and that's going to suck real bad. So, as Dr. Karen Becker said, foreverdog.com is where you want to head to get this ebook. Now, if you've noticed lately, we've been talking a lot about the foreverdog.com. That's because we're building a resource information center over there for health and wellness for pets. It's on a splash page right now, but as it's getting bigger, we're priming for the September release of our international book through HarperCollins. Scientific strategies, new ways on how to get your dogs to live happier, healthier, and longer.
So in conclusion, what we want you to walk away from this Facebook Live thinking about is the fact that we don't want you to wait until your dog or cat begins exhibiting symptoms of having problems on NSAIDs. Those symptoms are vomiting, lethargy, diarrhea with dark tarry stools, even a change in stool color to be a little bit darker, a change in appetite, or an increase in water intake. We highly recommend that you start a proactive supportive protocol the minute that you start those NSAIDs if your pet's going to be on them long term.
As always, have more questions at the end of all of these Facebook Lives. We have our Facebook support group where we head on over. I'll be there. Dr. Karen Becker will be there to answer some of your questions that you might see today or in the ebook. And we have a special guest. We have expert human/dog physiotherapist Sarah McKeegan, who's going to come in and teach you how to build a more durable dog in the support group and questions you might have for us.
I'm also going to cover kitties. Kitties in pain management is an important thing. Thanks so much,
Facebook
guys.
world, thanks so much for tuning in. We'll see you again.